Good afternoon, Contra Costa community. We want to thank you for making time on New Year's Eve to attend this webinar. We are going to be discussing today the COVID-19 vaccine at your facility locations and an additional opportunity the county is providing to you as a provider to get your staff and residents the vaccine. We're going to start off today with Dr. Sarah Levin. She's our Deputy Health Officer in Contra Costa County and has been leading the efforts to mitigate the disease in our long-term care communities, specifically RCFEs. So Dr. Levin, I'm going to go ahead and turn it over to you. Thank you so much for being here today. Want to encourage participants that as questions pop up, go ahead and drop those in the chat or the Q&A and we will absolutely get through them. So Dr. Levin.
Thanks, Nicole, for the introduction. Good afternoon, everybody. Happy New Year. We are all looking forward to ending 2020 and coming into 2021 as a much better year. And we are at the County Health Department trying to figure out how we best and as quickly as possible get everyone that first vaccine dose, especially long-term care facilities. So we have been working in partnership with our hospital systems, as we have throughout this pandemic, to figure out, and with our community-based partners, Choices in Aging and our Ombudsman office, to really figure out how we can best move the vaccine from our freezers to your arms. And we are partnered with John Muir and going forward, we're planning other partnerships, hopefully with some of our community-based providers like Lifelong and Contra Costa Regional, and we're working trying to establish relationships with other systems to really get clinics out to you as soon as possible. We know that most of you are enrolled in the long-term care facility federal pharmacy partnership, and that they did announce to the state that will Part B, which is the residential facilities, will be starting on January 15th. And some of you may have already heard from that, but my understanding that because the SNFs, the skilled nursing facilities, were prioritized, we weren't sure when they were going to get to our residential care facilities, which we feel are just as at risk for suffering severe consequences of COVID-19 infection. So that was the nature of this mobilization, which is really how do we start getting stuff to you if possible. So with that, we have been dividing up the different facilities across the county, and John Muir has graciously, as a community partner, started us off even before our county medical reserve corps teams, which will start next Monday, but with a focus on our residential care facilities. So what we want to talk with you about today is how what we are going to need from you in order to do this most efficiently and effectively with your residents and your staff members at facilities. So with that, I'll turn it over to Judy Bartlett from John Muir, who will go over a bit of what's going to be required of you to do this effectively. Thank you.
Thank you, Dr. Levin. As Dr. Levin said, we started this week, so we are learning as we go. We did our first facility yesterday. Quite a bit from that effort. We have partnered to use a tool in order to get all your residents registered prior to us showing up on site to administer the vaccine. And I'm going to show you a little bit about what that looks like here. Bear with me 1 second. And it's thinking about getting there. Not going yet. How about now?
Yes, we can see it.
Okay, there we go. It's just took a little bit of time to think through this. What we are using is an application called PrepMod, and this is something that the state of California is using as well as the county in order to track the vaccine. So what will happen is once we schedule your facility for your date, we will send you a link to this application and you can go in and put in your residence. You'll see we're collecting the demographic information, pretty simple and straightforward. It's basically fill in the blanks, name, mother's maiden name, race, ethnicity, date of birth, age, gender, an email address if there is one, phone number, and address of the individual. Insurance information if you have it. If not, no insurance is perfectly acceptable as well. These are the screening questions. They'll be listed in the registration as well as reviewed with the individual when they show up for their vaccine. You'll check off this is their first vaccination for COVID. If you are filling in this form for someone who is not in front of you, your residents, for example, it's perfectly acceptable to click I don't know through all of these because they will be reviewed at the time of vaccination. The next thing you'll see is we are going to be using the Pfizer vaccine. There's a consent. We will also be providing the fact sheet for the Pfizer vaccine at the time of vaccination. There will also be a consent form that folks will complete when they're there. Again, if you're filling this out for someone else, you'll click in type my full name and you'll type in your name. Relationship to patient down here will be other will be a choice. So if you are completing this registration for your residents, you'll select other, fill in your name, and save. That's pretty much it that will be required in order to get you through the registration. This will provide us a list of everyone that we will be expecting when we come on site. It is really important that we get everyone registered ahead of time so we know how much vaccine we need to bring at the time we schedule. Now, I'll stop there in case anybody has any questions for me.
Doesn't look like we have any questions yet, but I'm sure that they'll come up through the time. Oh, this is great. So someone asked, what's kind of the timeline around when they can expect the clinic to be scheduled? It's the magic question.
Nice segue.
Right. So I'm Crystal. I'm from John Muir, with the vaccine clinic operations, and we had a clinic yesterday. So we have some education that we've already learned of our process success and our fallouts. So when can you expect to have your clinics scheduled? We are still working on scheduling. We're hoping to get two first rounds completed next week, and then after that we will see how our we have to get our support really lined up. So we unfortunately, we really wish that we could have your schedules already set right now, but we don't. But we do have 2 buildings that have been identified responsibility for. So what I want to do is kind of walk you through what to expect date on the calendar. You'll get a phone call probably from me. We will let you know what your date is. And this hopefully will be, will give you some time to prepare. What Judy was going over is the registration. We really do need every person that you expect to get a vaccine pre-registered before we get there. Before the date, one of us on our team will come by and take a tour of your facility so that we can help set up the best area for the clinic. What we will need when we get there is we'll have a registration table, We will have a vaccine clinic area that will have around 4 to 6 vaccine stations, and there will be a checkout area. And then also we will probably ask that you use your dining room as a very large area where you can socially distance the vaccine recipients for observation. So observation takes about 15 to 30 minutes for each resident or staff member. We will be vaccinating. Our hope is to vaccinate every single resident, every staff member that you have employed, and all of the either private duty or family caregivers that are in the facility on a regular basis. Do you need a copy of your insurance cards? You do not need a copy of your insurance cards. We do ask that if there is a form of ID, that form of ID. Also, on the day of the clinic, we will be needing some support from your staff. We need help with directing residents and staff members. We will also need, if there is an LVN or an RN that you have scheduled for the day of the clinic, we would like that person, that clinician, to be watching over the residents and the staff members in the observation area for us. Our clinical team will be dedicated to administering vaccines. We are also hoping to bring a pharmacist with us. That pharmacist will be able to answer any questions. However, prior to the vaccine clinic, we do ask that if any of your residents or your staff have questions, that they consult with their PCP prior to the vaccine clinic day. And then another tip is when you're sharing this information with your building, if they wear vaccine-friendly clothing so that we can easily access the deltoid muscle on either arm, that would be much appreciated. And are there any other questions for me? Will you be providing EpiPens? We will have a vaccine toolkit with us that will have medications that will be prepared to address any adverse reactions. So we will have that with us. If you do have any staff or residents that carry EpiPens with them for various allergic reactions, we do think it is an idea to have that EpiPen handy if any previous reactions to any vaccine. We did have one staff member at the RCFE yesterday who is allergic to bee stings. She didn't have her EpiPen on her, but she tolerated the vaccine very well. So she wouldn't be one to need the EpiPen with her, but if there are any other reasons, let's see. Will you give the vaccine to those who have been COVID positive in the last 90 days? We give the vaccine to previously COVID positive patients or staff members. We do want the person receiving the vaccine to be feeling well. So we advise that it is administered after their isolation is completed and making sure that their symptoms are improving. If anyone has monoclonal antibodies, we will not give the vaccine for about 90 days after administration of monoclonal antibodies as a treatment to COVID encountered. If someone received the flu vaccine, we will ask them to wait at least 14 days. If someone has received the shingles vaccine, we are asking that they wait at least 28 days. All right, any other questions for me?
Crystal, we have a Q&A here, which is asking, what if a resident decides at the last minute, or even a staff member, that they would like to be receive the vaccine, but they weren't pre-registered? Is there a way to make sure that they are included in these clinics?
Yes. Well, I do. This may create an issue where someone would be turned away. It just depends on the number of vaccines that we bring with us. Once the vaccine is reconstituted by the pharmacist, we have about 2 hours to administer it. This is according to our pharmacy protocol at John Muir. And once that vaccine is drawn up in a syringe, we have about an hour to administer the vaccine. So, and the vaccine also has to be kept in a certain temperature. We bring ice chests and thermometers to make sure that the vaccine is at a proper temperature. So we have to make sure that when we take that vaccine out of our freezers, our commercial freezers, that we have to not take more than what is needed. We need to, and that's why we're asking that you pre-register every person that you expect to have the vaccine on the first day. And then we will set a day about 3 weeks after that clinic where we will return and provide a second dose or the first dose for those who had to miss that first clinic. So to answer your question, I'm sure we will have a few extras with us, but we cannot count on a large number of staff or residents that were not pre-registered to have a vaccine available on the day that we are there. We have a little bit of a smaller group this afternoon and this morning, but please feel free. You have our time, ask questions if you have any.
I see a question in the box that I can address. This is Dr. Levin. Does it help to take an antihistamine prior to vaccine if you know you have multiple allergies? So we aren't directly recommending this. We do recommend that if you have multiple allergies that that you certainly have what's available to you, your antihistamines if you ready, if you should have a reaction. But really, truthfully, the majority of people, the great majority of people are not having allergic reactions. So the only contraindication to giving the vaccine is that you have a history of anaphylaxis specifically to the vaccine products. But the one thing that we are, there's been discussion about and recommending is that it's not a bad idea to potentially pre-medicate with something like Tylenol or ibuprofen for the expected vaccine side effects more likely to happen after the second dose, which is could be muscle aches, fatigue, soreness at the injection site.
John has another question about the DSS recommending only 50% of staff get tested on the first round to reduce possible call-offs from complications. What are our thoughts on this? We at John Muir, we vaccinated 6,000 employees in the last 2.5 weeks. And we have not had any issues with call-offs related to administration of the vaccine. However, I know that John Muir and the county and the Ombudsman and Choice in Aging, we're all going to work together to make sure that we are reviewing these recommendations and vaccinating all of the people appropriately who need to be vaccinated. So I don't know if Dr. Levin has any other thoughts on that.
Sure. I wasn't aware that they specifically said 50%. We certainly are not seeing in the first round really any significant impairments of staffing in our acute hospital staff. Similarly, at Contra Costa Regional Medical Center, most of the acute hospital staff have been vaccinated, and I'm not aware of any call-offs. So there's basically very minimal effect after the first one, mostly pain at the injection site. And so I think what's most important is that the sooner you get that first dose, the more quickly you're protected. We know that people get 52% of protection within 7 days after that first dose, and they get 95% protection within 7 days to 10 days after that second dose. So we get the vaccination started, the better. So getting that first dose in, even if you stagger the second dose, is probably the most important thing.
And you know, one thing we can do is we can connect with the RCFE that we just vaccinated, and we can see how it was for them. We vaccinated about 80 employees, or maybe it was closer to 90 yesterday, and I'm sure they will have some data for us on Monday about how call-offs have been since.
Some questions here about when they would get the registration link, and also about what has kind of been your timing around how many vaccines can you administer, or what that pacing looks like.
Judy, do you want to address the registration?
Sure. The registration link, as soon as we know that we are going to be doing your facility and have a date in mind, we'll be able to schedule that link out to you so you can go ahead and get started putting that information into the system. Once we set your clinic up, we set up a schedule just like you would any other appointment type thing. Depending on the facility, depending on the staffing, would determine how many appointments per time frame we would be able to allocate during that period. But it will be as soon as we confirm that we've got a date and time set for your clinic.
So there's a question about will there be more than 2 vaccinations scheduled regarding if we cannot schedule the residents and staff for the first clinic, and will there be a third clinic scheduled? One thing I meant to say at the beginning that I didn't say is that this is something our local health department is doing in order to jumpstart the vaccination process. It will not exclude the possibility of getting the pharmacy program. So although we may not have more than 2 clinics scheduled on site from John Muir or whatever community partner is participating, there you will still be having the opportunity to schedule with the pharmacy partnership. And there, if you start reaching, they're not mutually exclusive. And that was clarified yesterday at the state, that accepting this does not mean that you don't get the pharmacy partnership clinic schedule. So in total, you should have the opportunity to schedule more than the clinics that are offered by our site.
I think there was another question about how many vaccines can we do in a day. Yesterday we started the vaccines at 8 o'clock. A group of us arrived around 6:45 to help set up, and we started at 8. We did 162 by 2 o'clock, and we had some lulls in our day. So depending on how many vaccine stations we're able to set up, and that will be dependent upon the nurses and physicians get to come with us. We can do as many, we can do as many as 30 in an hour if we have 5 vaccine stations. So if there's an opportunity as well for any of your clinic to help administer vaccines at your RCFE, we could even do more. So it's about one resident per vaccine station, or 1 patient every 10 minutes.
Maybe we can talk a little bit about, if you are, after hearing this, if a facility is interested, what they can do to indicate that they would like to participate in this program. And so Chelsea, if I can get you to drop your email in the chat, that would be great. And so everyone, you're going to email Chelsea, and you're going to say your name, the name of the facility that you represent, the current number of residents, and the current number of staff. And of course, again, your email as well. And then that will add you to the list so that Crystal and Judy and their teams will reach back out to you again when they have a better sense of the timing and when they're going to be able to schedule clinics. And as we said, we're learning more every day, adding things to the process. So again, Chelsea just left her email in the chat. It's cvelez@choiceandaging.org. And again, it doesn't mean you're signing in blood. It just means that you're interested. And again, as Dr. Levin said, it does not preclude you from working with the pharmacy partnership as well. I want to encourage folks to add their questions. If you have more, we're happy. This is a great time. We have a question here of how will the CVS or Walgreens use the same type of vaccine for follow-up? Will they have that supply?
So I can answer that. Right now, we do not know whether they will have a matching supply. From the allocations we're getting, we're hopeful that this will work out. This is being sort of addressed at the state level, and they're looking into whether or not we can actually allocate as the local health department to the pharmacy clinics so that they can run even more clinics. What is important is that whichever one you start with, that you get the second dose is the same manufacturer. So if you get the Pfizer, which is the one we are allocating with the first dose, then you need to get the Pfizer with the second. If that's not available in that for the second dose within the next of the pharmacy clinics, it will be available through another means, through these, not necessarily an on-site clinic. It may involve coming to an off-site clinic at the county. But when you get your vaccine, your first dose, you will get a card that says which product it was that you received. It will also be in the PrEP mod system. And essentially that you will be able to use that access the second dose. If you miss it at the on-site clinic, you will be able to access it through another provider, or what we're calling pods distribution site.
Can you just circle back to the question around insurance cards? Will a facility be required to have a hard copy of the insurance card?
Let me try and take that again. You will not be required within our clinics, right? John Muir is not requiring that. What we did hear, though, from our SNF partners with the pharmacy program, one of our SNFs did get CVS coming out, and that was actually the issue that slowed throughput the most, because it sounds like they were having more requirement for insurance verification. I hear on the state call yesterday that's hopefully that will start to get mitigated, because there is concern that is not necessary. But for right now, that's what we're seeing. But for these clinics with John Muir and with any of the county clinics, will not be required to do that. I do want to also, I think I didn't make the point, these vaccines are all free. There may be, with the insurance, the only issue is the administration fee. So if you do have insurance and we can register it, then the insurance can be charged for the administration fee. But the vaccine itself is free. It was paid for with US taxpayer dollars and were no cost.
I think they are quieter towards the end of the day. 2020 has taken it out of all of us. I just want to reiterate, if you're interested in moving forward, you can email Chelsea at cvelez@choiceandaging.org. She'll add your facility to the list. You'll just need your name, your email, the name of the facility you represent, and the number of staff and the number of residents. One thing we haven't touched on that we talked about earlier today, and I'm wondering if Crystal, can you speak to if they have a move-in date set for a resident, but that person has not yet moved into the community, how they should handle that?
Oh, that's a great point. Thank you. So if you do have any residents that are planning to move in, they have put down their down payment, they have a move-in date, but it is prior to the vaccine clinic date. They are more than welcome to register, pre-register, and to receive their vaccine even before they move in. If you have residents move in after the administration of the first vaccine, I'm sure we can administer their first vaccine at the second date. I don't know what it looks like if it is beyond then. We did have yesterday 25 people who were not, who had paid their down payment, they had a move-in date, and they received their vaccine. So it was very easy as long as they're pre-registered.
Let's give folks a few more minutes to drop any burning questions into the chat or Q&A. You guys, this is a great opportunity to ask Crystal and Judy and Dr. Levin any questions you may have. So please don't leave here with something that you just didn't want to ask or weren't quite sure of. This is a tremendous opportunity to learn how your facility can move up in the process.
Just while we wait to see if there's another question, I just want to make one more point. I'm not sure that we made it. We may have, and I'm sorry if I'm repeating, but if you do have regular care agencies that you work with that are coming in on a regular basis, please do outreach to them and let them know that they can also participate in these clinics if they're coming in to provide regular care services to your residents.
And I think we mean caregivers, correct?
Yes.
You know, John Muir Home Health RNs are already covered under John Muir Health's program. Hospice agencies, I do think we're going to be helping each other define the caregiver definition. For instance, if you have an assisted living resident whose daughter is there every day, all day, because she is essential to the care of that patient, then we want that daughter to be vaccinated since she's in your facility on a daily basis. But the daughter who comes to visit on holidays, that is not a caregiver.
Great clarification. Thank you, Crystal.
What about folks who are like hair or maybe podiatry that comes in? How would you think of those kinds of team members?
I would think definitely of the hairstylist who's coming in to do hair on a regular basis. Absolutely is included in the vaccine clinic opportunity. A podiatrist, however, should have already had an opportunity. I mean, we've and Judy, you can clarify. I mean, if I'm wrong, please correct me. But John Muir has reached out to all of our affiliated physicians to offer the vaccine to physicians at this point. So I don't know if the Dr. Levin
is dedicated to those facilities, and that's their prime place of work. I would think that they could think about it as the same way you think about who you've had to test on a regular weekly basis because they're coming in and providing regular care.
And yes, Crystal, you are correct. We've reached out to the independent practitioners in the area, and they started part last week and have been scheduling this week and next week for their vaccinations as well.
Well, if we don't have any more questions and if no one else wants to give any more information, which we would welcome, I want to take a minute to thank John Muir Health and Contra Costa Health Services for making this available, for stepping in and being good citizens and stewards, and how much we appreciate that. And so I just want to say thank you, and how much we appreciate you taking the time to do this training and prepare facilities. Just so I see John asking, how can we schedule a date? John, you can email Chelsea and she will get you on the list. And then Crystal and Judy and their team will work with you to schedule that in the coming weeks. Well, I think with that, I think we are done a little bit early. So
Happy New Year, everybody.
Happy New Year, everyone. I want to thank everyone for participating. We will send out the recording along with this morning's recording early next week, and you will be hearing from us. So I wish everyone a safe and healthy New Year, and looking forward to a bright 2021.
Thank you.